Hi, everyone. Thanks for joining tonight. This is our 10th and last training session for our Building Capacity Project. And as this funded project comes to an end, we will hear from two of our consultants who have been with us before. Dr. Cronholm and Dr. Kaerney will provide us with an engaging session so we can apply everything we've learned towards our upcoming projects and funding opportunities. So with that, I will pass it over to Dr. Cronholm and Dr. Kaerney.
Matt will be joining in just a sec, but we were going to break into some small groups and to try to kind of think through some next steps. So trying to look at the top results we got out of the nominal group, and then have each of the small groups try to kind of think through some specifics with trying to brainstorm some ideas about projects that might come about from those topics. And then we also wanted the group to sort of think about what would be a way to sort of stay connected. I think some of you were on, we were talking about the last meeting being in December and, trying to think about as a group, what would be some effective ways to try to stay connected as we kind of build towards next steps. So I think, Chris, Matt, was there anything that you wanted to sort of add to orienting to the process?
I think it's just, on the Jane boards, we have just some guiding discussion questions to help everyone kind of like think through what the different potential outcomes of that could be. And so for the 4 different topics, at least, with each of those, we'll have those laid out. And then as Pete said, we'll have them and all kind of Jamboard sequence will be the ones about how you want to stay and what the frequency and cadence of all that would be.
So we'll spend kind of 15 minutes talking about trying to come up with some ideas for some research projects, and then about 15 minutes thinking about how to stay connected as a group. Then we'll come back together and kind of report back on that, and we'll go from there. Joe, do you want to kind of take us through?
Sure. So for the treatment options for mental health in the CHD community, what will the study design be? We got early intervention, very young versus intervention later in life, to look for differences. Desensitization therapy, support groups as an intervention to study, and both early and pre-intervention. And we also got aid care for families as well as patients who would be involved. People who had surgery as children, family involvement was important, different issues at different ages. And then for the outcomes, we're going to look at anxiety levels, depression symptoms, and PTSD symptoms. So from transitioning from pediatric to adult care, the study design, we wanted to look at earlier versus later intervention, what age to start transitioning, early care for patients as well as family, navigating care locations, so where adult congenital heart care locations were, care and aid for congenital heart patients, adult and children's resources and where to go, identifying who and when to transition, who would be involved, parents, children, doctors and nurses, and also the pediatric providers. And then for our study outcomes, you got understanding of the disease, understanding what you can and cannot do, not falling out of care, more partnerships between pediatric and adult providers, career options for the patients, and connecting with others going through this journey. For available resources to patients who live far away from an ACHD center, for the study design, we got how difficult it is to get to an ACHD center, identifying what people's needs may be, how care might be different in different settings, and what are the main reasons they don't have enough info on aid, doctors, mental health resources, and where to go, what to ask and how to ask. And then another one of the study designs was testing financial models to support patients and avoid costs, and then mapping needs with resources. Who would be involved would be the doctors and nurses and clinics in the ER, and referring providers, payers, organizations that might support costs. And for the outcomes, we got outcomes of patients cared for at ACHD centers versus adult cardiologists. And then we wanted to look at having a database to help make connections of the different resources and helping people decide which medical treatments are the best options for CHD. The study design wanted to look at impact on cost for different decisions, issues you want taken care of that aren't currently available, and mapping treatments for specific conditions, and different treatments available in different locations or regions. And then who would be involved, the patients, family members, and doctors, and the study outcomes, knowing the statistics of what works for whom.
Great job, Joe. All right, Matt, what did your group come up with?
The overall study design that we kind of gelled on for the treatment options for mental health in the CHD community would be to have a kind of different approach. So one would be looking at how we could best educate providers. And in order to do that, we would conduct survey or questionnaire research. We would compare patients who have needle phobia and PTSD associated mental health conditions and try and identify what the treatment differences were for them early in life so that we could tailor treatment options for each of those different groups. And so in that sense, then the outcomes would be looking at what the tailored treatment options would be. And we would be speaking with individuals, though, who had had those differences in treatment early in life. And essentially try and identify then, how could we tailor information for their future providers so that they know kind of more about what exactly their early experiences were as they go into that. In order to train the providers, though, as I said, we would be conducting some surveys and questionnaires with them in that sense. In terms of trying to understand transitioning from pediatric to adult cardiovascular care, we would look at individuals who had smooth transitions to adult care versus those who didn't, and what exactly their health outcomes were in adult care. And a large part of that would focus on how, and if at all, pediatric patients became aware that they could go and see adult specialists, and trying to understand what exactly were some of their differences that those who did transition had between their adult versus pediatric treatment. And we'd also like to try and identify ways to prepare the adult doctors ahead of time for patients who are going to be transitioning so that they have more information about specific cases, their patient-specific cases. So there's an example brought up about seeing a general cardiologist who didn't know about a certain specific condition, and how exactly we could identify that and provide it with the providers beforehand. And in terms of thinking about some study designs for this, we came up with the idea of conducting a survey or questionnaire of patients who were in the pre-transition stage, so between 15 and 18, to try and understand what some of the questions they had were, what their knowledge and awareness were of their own conditions and about adult care. And again, that could be to use to inform how we could increase awareness of adult care and thereby hopefully make it a smoother transition. There's some other metrics that were mentioned in terms of the outcomes. Could be looking at if there were any changes in quality of life, and that is patients' abilities to do certain things or not after transitioning from pediatric to adult care. And then one of the last was trying to identify what potential barriers could be to that transition. And so one of the early ones was if patients aren't aware of adult care, that they therefore wouldn't be doing the transition. But there were some other more kind of logistic ones, such as transportation. So how patients were able to see an adult care specialist. maybe in light of the potential, like where they're located, and that actually tied in next with the other challenge. To identify what the available resources were for patients who live far away from any CHD center, it was suggested we conduct a study of asset mapping of where these centers are to identify areas where there are no ACHD doctors, and then for those patients to provide them with information about telehealth availability or video conferencing. Again, given that they aren't able to access due to transportation or some other logistical barriers, such as maybe being disabled. And the ultimate kind of outcome of the study they would hope to be would be to increase the access to information for people who are unable to access services, and so that we could create potentially a website or some kind of social media outreach campaign, as someone said, to create an information highway for those patients. And the last is in terms of trying to help people identify what treatments are out there. One of the big study designs would be to compare people who've had different types of procedures and what they think the outcomes of those were. And there are some different factors that might influence how patients decided to engage in different treatment options. So understanding patients' financial and insurance status and situations and how that might have impacted their decision to obtain certain types of treatment, as well as, for people who had gone through some of these different procedures, trying to understand exactly what the options were for them, both before undergoing a certain treatment procedure, during, and then afterwards. And so in order to do that, we would conduct research into understanding what the impact of different procedures were on their lifestyle or their medication requirements. And I think someone had said that it was very helpful that in their own decision-making process that their provider had provided them a lot of different options or information about the options, and then the patient was therefore able to then go and conduct their own research into those options to compare them.
Okay, well, we thought of ways that we can stay connected is to meet in person at some point in time. Someone mentioned that was, the original thought on this whole thing, and then COVID came up, so maybe at some point that can happen. We should be able to provide input on the next steps and to be informed of what the next steps will be. Also, social media, we can connect through that, and Facebook, the web page with the forum that's on it. We can leave comments there and read and look at what people are saying. We can open up to helping with research or developing surveys, or open to helping with the writing that needs to be done, whatever needs to be done next. We'd be willing to help to do that, and that would keep us connected. Frequency for meetings, we said monthly, and how can we best provide support? Through emails, texts for updates, or provide a newsletter. Those were the things we kind of went over.
So if anyone from our group would like to add anything potentially to this, or has any thoughts?
I like the idea of one time at least meet in person. That would be excellent idea at some point.
I like the idea of meeting in person as well. That's always, my favorite way. But I guess until then, exchanging like emails or numbers or social medias, whatever like people want to do, is a great way to just kind of keep up with each other until we are able to plan like an in-person meetup or something.
Well, I really appreciate everyone sharing. I think we got a ton of information and things that can be considered for next steps. Do you want to take it from here?
So thank you guys for a really great session that really kind of promoted a lot of good discussion. So thank you for that.